Most people over 60 breathe a sigh of relief the moment they hear the words, "Your blood pressure looks normal." But what if that reassurance is hiding the very warning sign that comes before thousands of strokes every year? The truth is, one good blood pressure reading doesn't always mean your arteries are healthy. In fact, sometimes the most dangerous clue isn't the number your doctor points to, it's the pattern almost nobody notices. Imagine waking up feeling perfectly fine, making your morning coffee, reading the newspaper, and planning the rest of your day. Then, without any dramatic warning, your speech becomes unclear. Your right hand feels strangely weak, and within minutes, your life changes forever. Many stroke survivors later say they never felt seriously ill beforehand. They believed they were doing everything right because their blood pressure had always been described as under control. A few months ago, I met a retired engineer named David. At 72, he walked every morning, avoided smoking, took every prescription exactly as instructed, and never missed a doctor's appointment. He proudly carried a notebook filled with blood pressure readings that looked reassuring at first glance. Yet when we examined those numbers more carefully, a hidden trend appeared. One that had been quietly developing for years without anyone recognizing what it meant. I've spent more than 2 decades caring for older adults with heart and circulation problems, and one lesson continues to surprise both patients and healthcare professionals alike. Stroke risk isn't always revealed by one unusually high number. More often, it's uncovered by understanding how your blood pressure behaves over time, how your arteries change as you age, and how small patterns can quietly predict much bigger problems ahead. Think of your arteries like the suspension system on a car. When everything is new, the ride feels smooth because the shocks absorb every bump. But after decades of wear, those shocks become stiff. Even if you're driving at the same speed, every bump hits harder. Your blood vessels change in a very similar way. As they lose flexibility with age, the pressure inside them becomes less stable, placing extra stress on the delicate blood vessels inside the brain. This is why focusing on a single blood pressure reading can create a false sense of security. Blood pressure isn't a photograph. It's a movie. One measurement only captures a single frame, while your body is constantly changing throughout the day. Morning readings, afternoon readings, nighttime readings, stress, dehydration, poor sleep, and even pain can all reshape the picture. Looking at only one number is like judging an entire movie after watching 5 seconds of it. Now, I don't want this to frighten you unnecessarily. A normal blood pressure reading is certainly good news, and many people with healthy readings remain perfectly well for years. The goal of today's video isn't to make you anxious or suspicious of every result. It's to help you recognize the hidden clues that deserve a second look, because catching them early gives you and your doctor far more options to protect your brain and heart. Today, I'm going to walk you through 5 warning patterns that many seniors overlook. These aren't rare diseases or complicated medical mysteries. They're everyday changes that often happen quietly after the age of 60. Some can be improved with better monitoring. Others simply require a smarter conversation with your healthcare provider. But every one of them has the potential to reveal risks that a single blood pressure reading may completely miss. Let's begin with the first warning sign, and, in my experience, the one people underestimate the most. It isn't an unusually high reading. It isn't an unusually low one either. It's when your blood pressure begins swinging dramatically from one day to the next. Those unpredictable ups and downs can sometimes place even more strain on your arteries than a consistently elevated reading, and very few people are ever told to watch for it. Let's say your blood pressure is 118/72 on Monday, 152/84 on Wednesday, and 126/70 by Friday. Many people see the lower reading and feel relieved, believing everything is back to normal. But your arteries experienced all 3 readings, not just the good one. Those repeated swings can place extra stress on the blood vessel walls, especially in the brain, where delicate arteries become more vulnerable as we grow older. Why does this happen? Blood pressure isn't controlled by just one system. Your heart, kidneys, nervous system, hydration level, medications, sleep quality, emotional stress, and even room temperature all play a role. As we age, these systems don't always respond as smoothly as they once did. Instead of making small adjustments, the body sometimes overcorrects, causing blood pressure to rise and fall more dramatically throughout the day. Several studies have suggested that greater day-to-day blood pressure variability may be linked to a higher risk of stroke and cardiovascular events, even when the average blood pressure appears acceptable. That surprises many people because we've been taught to focus almost entirely on the average number. But imagine driving a car that constantly speeds up and slams on the brakes. Even if the average speed is reasonable, the ride is far more dangerous. I remember meeting Margaret, a 68-year-old grandmother who insisted her blood pressure machine was broken. Every reading seemed different. One morning it looked perfect. That evening it was unexpectedly high. The following day it dropped again. She almost threw the monitor away out of frustration. Fortunately, instead of replacing the machine, we looked for the reason behind the pattern. It turned out dehydration, poor sleep, and inconsistent medication timing were all contributing to the fluctuations. Rather than worrying about one surprising reading, start looking for consistency. Measure your blood pressure at approximately the same time each morning and evening. Sit quietly for 5 minutes before taking the measurement. Keep both feet flat on the floor, avoid talking, and write every reading in a notebook or app. Over 2 weeks, those numbers begin telling a much more meaningful story than any single measurement ever could. Now let's move to the second warning sign, and this one catches many seniors completely off guard. It's called the morning blood pressure surge. Your body naturally prepares to wake up by releasing hormones that increase heart rate and blood pressure. That's perfectly normal. The problem begins when that morning rise becomes much larger than it should be, placing sudden stress on arteries that may already be stiff or narrowed. Think of your circulation like turning on a garden hose. If the hose is flexible, the water flows smoothly. But if it's old, brittle, and cracked, suddenly increasing the pressure places enormous strain on weak spots. That's similar to what can happen inside aging blood vessels. A sharp morning surge may increase the chance that a fragile artery could become damaged, or that a plaque inside an artery could become unstable. One patient told me he always measured his blood pressure after breakfast because he wanted to start the day calmly. Every reading looked excellent. Then we asked him to check it within 30 minutes of waking, before coffee, before breakfast, before checking emails. The difference shocked him. His early morning readings were consistently much higher than the numbers he had been proudly recording for years. He wasn't doing anything wrong. He was simply measuring at the wrong time. That doesn't mean everyone needs to panic over a higher morning reading. It means timing matters. If your doctor has recommended home monitoring, ask exactly when they want you to measure it. Recording the same time each day creates reliable information that can guide treatment decisions far better than random readings taken whenever it's convenient. And the next warning sign we're about to discuss is one that many people accidentally create themselves without realizing it. The third warning sign isn't hidden inside your body at all. It's hidden in the way you measure your blood pressure. I've seen countless seniors become worried over readings that were never accurate to begin with. Others believed they were perfectly safe because their monitor consistently gave numbers that looked normal. The truth is, even small mistakes during measurement can change your reading enough to influence important medical decisions. Here's something many people don't realize. Your blood pressure changes from minute to minute. Climbing the stairs, carrying groceries, having an emotional conversation, or even rushing to answer the phone can temporarily raise it. If you sit down and immediately wrap the cuff around your arm, you're measuring your body's response to activity, not your true resting blood pressure. That's why proper technique is just as important as the monitor itself. Research has shown that talking during a blood pressure reading, crossing your legs, or supporting your arm incorrectly can noticeably affect the result. That may sound insignificant, but imagine if your reading is close to the treatment threshold. A small measurement error could lead to unnecessary medication changes, or just as concerning, it could hide a problem that deserves closer attention. Accuracy matters because your treatment plan depends on trustworthy numbers. I once met a retired bus driver named Michael who insisted his blood pressure was all over the place. After watching him take a reading, the reason became obvious. He measured it while watching the morning news, drinking coffee, and chatting with his wife. Every reading reflected a different combination of distractions. Once he adopted a quiet 5-minute routine before measuring, His results became remarkably consistent, giving his doctor a much clearer picture of his health. If you measure at home, create a simple habit. Empty your bladder if needed. Avoid caffeine or smoking for at least 30 minutes beforehand. Sit comfortably with your back supported. Rest your arm on a table at heart level. Keep both feet flat on the floor, and remain silent while the cuff inflates. These small details may seem boring, but together they can dramatically improve the reliability of your readings. Now let's talk about something even more common: dehydration. Many older adults don't feel thirsty the way they did when they were younger. Some intentionally drink less water because they don't want to make frequent trips to the bathroom. Others take medications that increase fluid loss. Over time, this combination can quietly affect blood pressure in ways that aren't always obvious. Think of your bloodstream like a river. When water levels are healthy, the river flows steadily. But during a drought, the river becomes shallower and less stable. Your circulation behaves in a similar way. When your body doesn't have enough fluid, blood volume decreases, making it harder to maintain stable blood pressure, especially when you suddenly stand up after sitting or lying down for a long period. One of my patients, 76-year-old Linda, believed her occasional dizziness was simply another part of getting older. Every afternoon she felt slightly lightheaded whenever she stood up too quickly. After reviewing her routine, we discovered she often drank only 2 small cups of water before lunchtime because she wanted to avoid using public restrooms. Once she gradually improved her hydration, with guidance from her healthcare team, those dizzy spells became far less frequent. Of course, hydration isn't the answer for everyone. People with heart failure, kidney disease, or certain medical conditions may need personalized fluid recommendations from their doctor. But if you're generally healthy, making hydration a daily priority can help support more stable circulation. And speaking of daily habits, the next warning sign isn't about what you drink. It's about when you take one of the most common medications prescribed after the age of 60. The 5th warning sign has nothing to do with taking the wrong medication. It may simply be taking the right medication at the wrong time for your body. Many seniors take every pill first thing in the morning because that's the easiest routine to remember. While that works well for many people, it's not necessarily the ideal schedule for everyone. Your body follows a natural 24-hour rhythm, and your blood pressure changes along with it. Blood pressure doesn't stay the same from sunrise to bedtime. For most healthy people, it rises before waking, remains higher during active hours, and gradually falls while sleeping. Certain blood pressure medications are designed to match these natural changes. If the timing doesn't fit your body's rhythm, the medication may be strongest when you don't actually need its full effect, or weaker during the period when your blood pressure naturally climbs. This doesn't mean your prescription is wrong. It means your treatment may need to be personalized. Some people experience dizziness every afternoon because their medication reaches peak strength at the same time their blood pressure naturally dips. Others wake up with unusually high readings because the medication's effect has already begun wearing off. Without tracking blood pressure at different times of the day, these patterns often remain completely hidden. I remember caring for a 70-year-old retired librarian named Susan. Every morning she felt energetic, but by late afternoon she struggled with fatigue and occasionally needed to sit down after standing. At first, everyone assumed it was simply aging. After reviewing her blood pressure log alongside the timing of her medication, her physician adjusted the schedule, not the dose. Within weeks, those afternoon episodes became far less frequent, and she felt more confident returning to her daily walks. Please don't interpret this as advice to change your medication schedule on your own. The safest approach is to bring a detailed blood pressure log to your next appointment and ask a simple question. Do the times I'm taking my medication still match the pattern of my blood pressure? That single conversation may reveal opportunities to improve treatment without adding another prescription. Now I'd like to ask you something. When was the last time you actually looked back at 2 weeks of blood pressure readings instead of only today's number? Most people can't remember because they never keep a written record. If you already monitor your blood pressure at home, tell me in the comments. Do you record every reading, or do you simply look at the screen and move on? Your answer may help someone else realize they're not alone. Before your next appointment, prepare 4 simple questions for your doctor. First, are my readings staying consistent throughout the day? Second, Should I be checking my blood pressure at different times? Third, could dehydration, poor sleep, or another medication be affecting my numbers? And fourth, based on my age and medical history, what blood pressure range is safest for me personally? Those questions often lead to much more meaningful conversations than simply asking, "Is my blood pressure okay?" Here's the encouraging news. Most stroke risk factors don't appear overnight. They develop gradually, giving us valuable time to notice changes and respond. Better monitoring, healthier daily habits, regular physical activity, quality sleep, balanced nutrition, and personalized medical care can all work together to reduce risk. You don't need perfection. You need awareness, consistency, and a plan built specifically for your body, not someone else's. Not long ago, one of my older patients returned for a follow-up visit carrying the same notebook we had started months earlier. This time, however, every page told a clearer story. Instead of scattered readings and uncertainty, there were organized patterns, thoughtful notes, and questions prepared in advance. Together, those details helped us adjust his treatment before a serious complication ever occurred. And that brings us to the most important lesson of this entire video, the one I hope you'll remember long after today's discussion ends. If you've watched this far, you've probably realized something important. Stroke prevention isn't about chasing one perfect blood pressure number. It's about understanding the story those numbers are telling. Every reading is like a single puzzle piece. On its own, it reveals very little. But when you place enough pieces together, a clear picture begins to emerge, sometimes months before your body develops obvious warning signs. One of the biggest mistakes I see is people celebrating one excellent reading while ignoring the trend developing around it. Imagine checking your home's roof only on sunny days. You'd never notice the small leak until the first heavy storm arrived. Your cardiovascular system works much the same way. Problems often develop quietly, and if you're only looking occasionally, you may miss the gradual changes that matter most. So here's a simple challenge I'd like you to start this week. Choose one consistent time every morning and one every evening. Use the same chair, the same blood pressure monitor, and the same routine. Record the date, the time, both blood pressure numbers, your heart rate, and any symptoms such as dizziness, unusual fatigue, headaches, blurred vision, or feeling lightheaded. It takes less than 2 minutes, but those notes can become one of the most valuable tools you bring to your next doctor's appointment. While medication plays an important role for many people, don't underestimate the power of everyday habits. A brisk walk most days of the week, limiting excess sodium, eating more fruits and vegetables, maintaining a healthy weight, getting quality sleep, managing stress, and staying physically active all support healthier blood vessels over time. None of these changes work overnight, but together they create a stronger foundation for your heart and brain. I still remember George, a 74-year-old grandfather who believed aging meant becoming weaker every year. Instead of giving up, he committed to small improvements. He walked for 20 minutes each morning, tracked his blood pressure consistently, drank enough water, and worked closely with his physician. 6 months later, he wasn't celebrating a miracle cure, he was celebrating confidence. He understood his body, felt steadier on his feet, and no longer feared every blood pressure reading. Remember this, your blood pressure isn't trying to scare you, it is trying to communicate with you. Every reading is information, not a verdict. The earlier you learn to understand that information, the more opportunities you have to protect your future. Healthy aging isn't about eliminating every risk. It's about recognizing the signals while you still have time to act. So let's quickly review today's 5 warning patterns. First, watch for large day-to-day swings instead of focusing on one reading. Second, pay attention to your morning blood pressure. Third, use proper measuring technique every single time. Fourth, don't overlook the effects of dehydration and daily habits. And finally, talk with your doctor about whether your medication timing still fits your body's natural rhythm. If this video helped you see blood pressure in a completely different way, let me know in the comments. Tell me your age and whether you check your blood pressure regularly at home. Your experience could encourage someone else to begin monitoring their own health before problems develop. And if you have a parent, spouse, sibling, or close friend over 60, please share this video with them today. One simple conversation could make a meaningful difference. Finally, remember that this video is for education only and should never replace personalized medical advice. Never stop, start, or adjust your blood pressure medication without speaking with your healthcare provider. Every person's medical history is unique, and treatment should always be tailored to the individual. Thank you for spending these minutes with me. Take good care of your heart, protect your brain, and I'll see you in the next video.